will stand up again. We will march again. We will preach again. We will organize again. We are black. We are white. We are Latino. We are Native American. We are Democrat. We are Republican. We are independent. We are people of faith. We are people not of faith. We are natives and immigrants. We are business leaders and workers and unemployed. We are doctors and the uninsured. We are gay. We are straight. We are students. We are parents. We are retirees. We are North Carolina, and we're here, and we ain't going nowhere.
Good afternoon. My name's Jim Duffet. I'm a new resident in North Carolina. I've only been here for about 2 months, and the first two things that I did was I got registered to vote and joined the Chapel Hill Carborough NAACP. For 26 years, I was fortunate to be the executive director of a largest healthcare advocacy organization in Illinois. You know, my parents instilled many family values in my family. And one is do unto others as others would do unto you. Regrettably, that family value and the value of liberty and justice does not seem to apply to Speaker Tillis, Governor McCory, and Senate President Berger. They're proud in their achievement, as we heard today, in blocking the doors for over 500,000 North Carolinians to get access to health care. Who are some of these people? 59,000 of them are construction workers. They're probably people who work around Thom Tillis's house to make it better.
Wait a minute, Jim, say that again.
59,000 are construction workers. 56,000 are food service workers. These are the folks that probably are serving lunch and dinner at his fundraisers. 23,300 are veterans. These are the people who go and defend this country for freedom. These are the people that Thom Tillis wants to send to the Middle East on a quick notice, but when they come back to North Carolina, he wants to throw them underneath the bus. This immoral and extreme right-wing mentality reminds the people of North Carolina of another era of immorality and extreme racist actions. It's the same way that curriculum reform in the South in the 50s and the 60s took a back seat to getting African American children into the schoolhouse. So too is Thom Tillis' health care policy here in North Carolina, taking a back seat to the working poor citizens in getting access to health care. We have a new vision now in North Carolina, a new vision of Mr. Tillis, Mr. McCory, and Mr. Berger standing in the doorway of our hospitals, blocking access to people getting access to health care. For all of us who are fortunate to have private health insurance, don't think that this issue isn't going to affect you at all. Ask the people of Belhaven. Ask the people of more and more folks of hospitals that are going to close. I may have private health insurance, and I may not think expanding Medicaid is going to affect me. But if my local hospital closes, where am I going to use that access to health care? Two more things that I want to stress, about, and it was talked about here, about 2,800 lives of people dying because of this. We've had one death on the Ebola case. It's a serious, serious issue. But where is Thom Tillis, and where is the leadership to stand up for 2,800 people who are going to die in North Carolina? Lastly, I also want to add another thing to those folks who have private health insurance. I call this the Thom Tillis, Berger, McCory ignorance tax. For those of us who have health insurance, nearly $1,000 more a year that we pay because of cost shifting. Because the hospitals are eating the cost of people who don't have health insurance. They pass them on to the insurance industry, and the insurance industry passes them on to us. Because of the actions of Tillis and Berger and McCory, all families in the state of North Carolina are paying another $1,000 a year. Think what you could do for that $1,000 a year. Forward together, one step back. Thank you very much.